Hello everyone. Topic for today's discussion is diabetic ketoacidosis, which is also known as DKA. Actually, this diabetes ketoacidosis is a type of metabolic complication. Diabetes complications can be divided broadly into two broad categories: acute complications and chronic complications. In acute complications, again, there are two types. First one is various kind of infections, and second one is metabolic complications. So this diabetic ketoacidosis is a type of metabolic complications. Apart from this diabetic ketoacidosis, we have some other metabolic complications like HHS, that is hyperosmolar hyperglycemic state. Third one is hypoglycemia. Fourth one is lactic acidosis. When we see the chronic complications of diabetes, so it includes various kind of vascular complications, and again these vascular complications can be divided into two categories: microvascular complications and macrovascular complications. So about these two types of vascular complications we will study in details in subsequent videos. Let's see definition of DKA. So we have already studied that DKA is a state of metabolic decompensation. It is a kind of metabolic complication, and this DKA is a consequences of severe deficiency of insulin. And this DKA can be defined as high blood glucose level in the blood, and because of that there is presence of ketone bodies in the urine, and this decay is often caused by taking too little insulin, or there is no insulin during the illness. If any person is having diabetes mellitus, and there may be two reasons: either the person is taking too little insulin in respect of the insulin required to control the disease, or he is not taking any kind of insulin. In these two conditions decay can be found. Usually this decay is seen in type 1 diabetes mellitus, but it is also noted that it can be present in some other types of diabetes, including the type 2 diabetes if it is poorly controlled. So this decay is a condition of hyperglycemic, means there is a high level of sugar in the blood. It is a condition of hyperketotic, means high level of ketone bodies in urine, and due to this high level of sugar in blood, there is a condition of hyperosmolar, means osmolarity of blood will be increased. And all these conditions are happening, as we have already studied that either there is relative insulin deficiency or there is absolute insulin deficiency. Apart from these conditions, it is also noted that there is increase in counter regulatory hormones, and these counter regulatory hormones are glucagon, cortisol, growth hormone, that is also known as GH, and catecholamine hormones. So these are some counter regulatory hormone which are increased in DKA. When we see the mortality rate in DKA, so it ranges between 3 to 5%, and it is one of the known case of cause of death in a patient of diabetes. Let's discuss about the pathophysiology of DKA. What are the process which causes of appearance of this DKA in diabetic patient? So we have already studied that there is either relative or absolute deficiency of insulin in the blood, and as well as there is increased counter regulatory hormones, about which we have already knew in previous slide. And because of these two conditions, there are some changes in some of the organs of the body. Like first, in adipose tissue, there is decreased utilization of glucose, and as well as there is increased lipolysis, means there is destruction of the lipids, or we can say fatty tissue. Apart from that, lipogenesis means genesis of lipids is also decreased. All these three reasons causes increase in free fatty acid, and which is a part of the destruction of lipids. This increased free fatty acid causes ketogenesis. Ketogenesis means there is increased formation of ketone bodies in the body, and these ketone bodies, if appears in urine, this condition is known as ketonuria, and if it is appear in blood, then it is known as ketonemia. And due to these two reasons, there is a condition in body appears which is known as acidosis, metabolic acidosis. So let's see what are the changes which happened in the liver. So in liver, there is decreased glucose utilization, as well as there is increased glycogenolysis, means glycogen is fragmented, it is lysed into glucose molecules. Apart from that, there is increased gluconeogenesis. So gluconeogenesis is a condition where the glucose is formed by the either amino acid or fatty acids or fats. So ultimately, all these three conditions causes increase in the sugar level of blood, which is known as hyperglycemia. So if this sugar glucose level will increase in blood, so this glucose starts appearing in the urine, known as glucoseuria. Apart from that, this ketogenesis condition will also appear, and which will cause the ketonuria. Ketone bodies will be produced and that will be secreted in urine, known as ketonuria. Also, because of this glucoseuria, glucose is going on in the urine, so there is increased excretion of water as well in urine, and these conditions causes dehydration as well as loss of some other electrolytes like sodium, potassium, magnesium and phosphate from the body. So this loss of magnesium, phosphate in urine, this causes again contributes in metabolic acidosis condition of the body. Let's see what are the changes which are there in the muscles. So in muscles also there is decreased utilization of the glucose, and as well as there is increased proteolysis. Proteolysis means the protein which is present in the muscles are getting destructed, and this causes genesis of amino acid, because this protein is made up of amino acids. So there is increase in the amino acid level in the body, and this amino acid, as I have already mentioned, this causes generation of glucose, which is a condition which is known as gluconeogenesis. So all these condition which ultimately affects the kidney, and so that there is decreased GFR, glomerular filtration rate, and ultimately it causes the renal failure. So these are the overall pathophysiology of the DKA. So we have seen that in diabetic ketoacidosis there is severe deficiency of insulin in the body, and as well as fatty acid is broken down into the small products, and this produces the ketones which is secreted either in the urine or in blood, and ultimately all this process causes the metabolic acidosis in the body. So finally, We can say that diabetic ketoacidosis is a triad of hyperglycemia plus ketosis plus acidosis. Let's discuss about the symptoms which are present in the DKA, diabetic ketoacidosis. So the symptoms which appears in DKA can be broadly divided into two categories. First one is specific symptoms associated with DKA. Second one, non-specific symptoms. So in specific symptoms, hyperglycemia will be there, ketosis will be there. Because of that, there will be increase in the ketone bodies in urine. There will be one specific kind of symptoms which is known as fruity scented breath. The breath will be fruity scented for the patient of any DKA. Let's see some non-specific symptoms which appears in DKA. So it includes excessive thirst, confusion, frequent urination, weakness or fatigue in the body. There will be shortness of breath, abdominal pain can be there, nausea and vomiting can be there in the patient of DKA. So let's discuss what are the signs and symptoms in DKA. So as we have already studied that nausea and vomiting can be there in a patient of DKA, and usually this nausea and vomiting that are the initial symptoms of this DKA. There may be abdominal pain also, and this abdominal pain can mimic as chronic pancreatitis or peritonitis. Weight loss and polyphagia can be there, and these conditions may precede the onset of DKA. Person can have tachycardia or hypotension, decrease in blood pressure, and these two conditions are happening as there are volume depletion, dehydration is present in this condition, as well as there is vasodilation. In this DKA, person sometimes feel difficulty in breathing due to gasping. He takes deep breathing and he puts effort for taking breath. This condition is known as Kussmaul breathing. Polyuria can be there, and this causes volume depletion and dehydration. Febrile illness, person can have fever also, and sometimes many a times this febrile illness that precede the onset of DKA. So there are two conditions which precede the DKA. A person can have fever, or he can feel nausea and vomiting. There are some symptoms which are related to the central nervous system depression. So due to this central nervous system depression, patient can be in a lethargic condition. He can be confused, drowsy. Sometimes he can lose his consciousness. There will be altered mental status as well, and sometimes patient can reach into the state of coma also due to cerebral edema. Apart from that, there are some other presentation of the central nervous system depression, like hyporeflexia can be there, hypotonia can be there, shock may be present due to dehydration, and due to dehydration as well there can be oliguria also, anuria also. There is no urination in the patient, or patient urinates a very less amount of urine, and all these conditions are very serious, very severe for the patient. So we have finished the first part on the presentation in respect of DKA. In the subsequent video we will find the second part of presentation which is related to the DKA. Thank you so much.